Under the Needle, where acupuncture meets anatomy. Today, we're exploring triple heater 5, one of the most commonly used points in clinical practice. Triple heater 5, or Waiguan, is located approximately 2 cm proximal to the dorsal wrist crease, between the radius and ulna on the posterior lateral forearm. Palpation typically identifies a soft groove between the extensor muscle groups of the forearm. This region serves as an important transition zone where muscular, facial, and neural structures pass between the elbow and wrist. Because of its location, triple heater is closely associated with upper limb mechanics and sensory regulation. Beneath triple heater 5 lie the extensor digitorum and extensor carpi radialis muscle groups, which contribute to wrist and finger extension. Deep to these structures runs the posterior interosseous nerve, a motor branch of the radial nerve arising from the 7th and 8th cervical spinal segments. The interosseous membrane between the radius and ulna also contributes to force transfer and forearm stability. Together, these structures create a functional relationship between movement, neural signaling, and load distribution through the upper limb. Clinically, triple heater 5 is frequently used for wrist and forearm dysfunction, particularly involving repetitive loading or extensor overactivity. Because of its neurological relationships, this region may also influence cervical and upper quarter tension patterns. In acupuncture practice, triple heater 5 is commonly used for headaches and neck restriction, reflecting its broader role in sensory modulation and regional connectivity. Its location along the posterior lateral forearm makes it especially relevant for movement-based dysfunction. In traditional Chinese medicine, triple heater 5 is known as the luo connecting point of the San-Jiao channel. It is commonly used for headaches, neck tension, and disorders along the lateral aspect of the body. It is frequently associated with releasing constraint and improving movement. From an anatomical perspective, this region contains structures related to wrist extension, forearm stabilization, and radial nerve function. These tissues connect mechanically and neurologically with the cervical and upper quarter regions. When these perspectives are integrated, triple heater 5 reflects both traditional concepts of restoring flow and modern understanding of neurodynamic and facial relationships. This is just one example of the anatomy we explore. If you want to study all acupuncture points systematically, deepen your clinical understanding, and earn continuing education credits, the Anatomy of Acupuncture Atlas and the full online course walk you through the entire framework. You'll find the links in the description.